Okay, so this is like so cool. It's like one of my favorite parts of my channel. It's where I share with you stuff that I do every day at work. I see cool stuff at work like every day, and I want to share with you those things. So first of all, you can see how my system works in the real world, but then you can kind of start to figure out the rationale behind this approach. And the best way to do it is with case studies. So let's begin. My first case study will be me. I don't know if y'all know what Rolfing is. It's deep tissue massage, where they go in and really try to get in and rearrange the fascia and just kind of realign things. So I had gone through several sessions, awesome, but for some reason I developed this headache and it didn't go away. Okay, and I pride myself, and I tell my patients this, like, oh, I don't hurt. I didn't really say that right. Like, I know muscles, I don't hurt, which is true. I don't hurt. I've had 5 spine surgeries, multiple knee, shoulder, but guess what? I don't hurt. And when I do, I can figure it out. So I'm going on, 1 week with just this headache hanging out in the back of my neck. So I go back to the Rolfer, and then he does some deep tissue work on the neck just to see, what's going on. The following week, I go to my massage therapist, work on the neck. In the meantime, I have been dry needling and doing IMES. Yes, most people who needle themselves. So I was using IMES for suboccipitals. I did lower paraspinals, both sides. I made sure I was getting like full contraction of the muscles using my vibration tools. And if you understand my system and all these terms I'm using, you'll start to, you'll have a better understanding of what I'm talking about with IMES and vibration and fascia. So here I am 2.5 weeks, and I still have this headache. And it's more the right side than the left. And so I'm like, go back to the basics. Start with the butt. Remember, glutes are the roots. So I stick some needles in my right butt and turn on my E-stim. So the E-stim machine I use goes from 0 milliamps to 10. Well, a healthy muscle, if you stick 2 needles in your butt and you hook up your little electrodes, that baby better start contracting immediately. Healthy muscles do. So my right gluteus maximus, it contracted like immediately, 1, maybe 2 milliamps immediately. My left gluteus maximus, dude, I'm telling you, I had that machine up to 10 milliamps, and my gluteus maximus was like, oh, okay, I'll try to wake up. Oh, I was so irritated. So I just maybe did a couple more needles and just needled the snot out of that thing. And I was starting to get a little contraction. Well, the next day I'm like, what I teach my patients, and this is what we talk about all the time, activation. So I used my electrical stim, get the muscles activated. Now I want to try to keep them activated with isometrics, but I still couldn't really find my butt muscles. So the following day, again, IMES. I think the muscle contracted around like 5 milliamps maybe, but I also put it on continuous, the 100 pulses per second, to develop an internal isometric. And so, it started contracting better, but I forgot to tell you, the day after I did my first needle session on my left glute max, even though it didn't really do much, even at 10 milliamps, the next day, 80% of my headache was gone. Like that. I did needling the following day, and then the day after that, no headache. The headache's gone. Gone. I needled my butt to fix my headache. Makes sense to me. What's even more cool, I go through that, then I have a patient, a 69-year-old lady I've been treating for a long time, long enough to know that when something's not working, you need to do something else. You know the definition of sanity, keep doing the same thing, expecting something different. That's insanity. Her main complaint was long-standing tightness, stiffness, just stuff. around her left cervical spine. Well, previous therapists did, the soft tissue, the traction. I came in with needles for suboccipitals, lower cervical, working on posture, trying to get thoracic spine movement, everything around the neck and the shoulders. She's not getting better. So last week I'm like, okay, that's it. I'm looking at the butt. I have her prone. I do needling on, so it's her left neck. I do needling. No, I did not do needling with her. Either I was not in the mood, or I don't know if she liked it or whatever. Sometimes I'm just not in the mood, okay? Very rare, but there are times. So I'm like, I'm gonna start her on isometrics. So I put her supine with hips and knees bent, band around the thighs, just proximal to the knees. And I did test the glutes and found that when I tested, the right glute was inhibited, the left glute not so much. We can talk about how you test for inhibition. That's in some other video somewhere else. I'm not going to cover it here. So her right glute, nothing. I mean, there was no inhibition total. So I put her supine, hips, knees bent. I put the red band around her distal thigh, proximal to the knees. And I had her stabilize the left leg, but the right one I had her go out into abduction, external rotation, like a clamshell, but she's supine. This is so cool. She does a couple and she's like, oh my God, my neck muscles are tightening. Like, why are my neck muscles tightening? So cool. Like right where her pain and all her stuff was. Like exactly. So I'm like, oh, well, that's interesting. Okay. Hold the right leg still, do the left. Did the left, nothing. I'm like, is that so cool? Now we have another sample of treat the butt to help the neck. So then I had her do another exercise called belly button. And that's holding the TheraBand. And the tension's coming here. And what you do is you move the TheraBand out like this, and it causes stuff on this side to contract to stabilize. So when I had her do this way, the band's over here, that would cause the right side of stuff to contract. She does that one, she's like, my neck muscles, they're contracting. Like, should I try to stop that? That's weird, right? So I turned her around, we did it the other way, nothing. How cool is that? Like a week before, I figured out treat the butt, help the neck, and then I have a patient like the next week who, I don't know what to do. We're not getting any better. What is going on? I treated her butt, and she felt it in her neck. This stuff is so cool. You can't make this stuff up. This is so cool.